Simula, specifically Simula Metropolitan Centre for Digital Engineering and Simula Research Laboratory, have been really excited to contribute to the search project with our expertise in synthetic data generation, very specifically in the area of cardiology. So we are leading task 3.2, which is structured and signal data generation, and we've concentrated a lot of those efforts in exploring OMOP standards and looking into how we can securely generate tabular data with partners. We're also working on ECG data generation. Furthermore, we've started to make headway on e-health applications for chronic cardiovascular diseases. So that's using synthetic data to produce models which essentially allow us to look at risk for disorders such as atrial fibrillation, and that one we're going to use ECG signals, synthetic data produced, and also ischemic heart disease, and we're going to showcase synthetic cardiac MRI in that area. The last thing that I'd like to mention is we wrote a first version of the clinical study initiation package 1, and that focuses on e-health applications for detecting chronic cardiovascular disease. We're really excited for the next year because this means we get to produce the synthetic data that we're working on. In our case, our effort in terms of domain is really focused on cardiovascular disease, and we're going to take our ECG models to the next level. So producing synthetic data that is not just representing a population, but could potentially represent individuals. That's also true for our efforts in task 3.3, where we're producing synthetic cardiac MRI data. We'd really like to look at a couple different disease profiles as well as individual data. So looking at patient-specific data generation, right? Synthetic patient-specific data generation. So that's super exciting, and we're interested in demoing the first clinical decision support tools as a demonstrator of the utility of the synthetic data we produced. For me, personally, some of the most exciting things about this project is, number one, the broad expertise that's both deep and profound across Europe in this project that's contributing to this IHI is humbling. I'm learning so much from my colleagues across all of the partners, 26 partners. In addition to that, I know that synthetic data in the healthcare space really has great potential for the dissemination of tools to people that need it, people with diseases, people developing pharmacological tools, people developing clinical decision support tools, and ultimately clinicians. So I think we can democratize the space by providing these solutions in the search project. So super enthusiastic.